Hello, welcome. Thank you for listening today to Matters of Substance. Today, I am here, Carley, your host, and we also have Jay and Chris. Chris has hosted before. Jay is a staff member here at the Hub Coalition of Porter County, and we're here to kind of update you guys on what's going on with our agency, specifically with a grant that all three of us work on, right, guys?
Yes.
Yeah, so today's episode is really going to take a focus on what we have going on, things we've kind of learned along the way. We're moving into year 3 of our Partnerships for Success grant. And we have been coordinating that and making sure that we get programs and educating the community, or programs into the community and educating people as well, and doing a lot of different things. And one thing that Jay will mention that she's put a lot of time in is the epidemiology profile. And so yeah, we're just going to kind of have a chat. So thanks, guys, for coming on today.
Yeah.
Yay.
Yay.
So I guess just to start us off, what I will do is explain what the Partnerships for Success grant is so that those of you listening will kind of have a basis of understanding of what we're going to be talking about. So we were funded a grant called the Partnerships for Success. It is a federal grant, and we are charged with providing prevention programs specifically targeting youth to reduce substance use disorder or substance use among youth. And our other goal is to increase awareness of substance use among the community. And so our goals a lot of times focus on alcohol, opioids, and marijuana, which are the identified substances that need to be most highlighted in our community. Jay knows a little bit about that, right, Jay?
Yes.
So we focus in on those specific substances, and we provide prevention measures for that. And so that's really what we do. That's just kind of the baseline of what we're doing. We have the grant for 5 years. We're moving into year 3 now. Throughout the last couple of years, we've done several different activities, and we're going to spend some time today talking about just the things we've done most recently. I think it would make sense if we start off by kind of sharing some of the data, which is the reason, right? The data is the reason of why we are providing these prevention strategies. So Jay, would you just share a little bit about what you've found over the last couple of years doing the work that you're doing here?
Yes. So we collaborate with local stakeholders, and we collect the data information from the state and the city level. So luckily, we do collect good enough resources and the data sources. So if I look at the mortality data last year, Porter County had a 39 deaths due to any drug use, and the 34 deaths caused by any opioid-related drugs, which includes 65% of males and 35% of females. The population age range between 35 to 44 years old, and this age group had the highest risk to die from the overdose. So that's one of the reasons why we need to target specific population, specific substance misuse at a county level, not only for the adults. So we are also look at the incarceration rates, underage drinking rates. So for example, I collect the information from Indiana Youth Survey. So Indiana Youth Survey collaborate with local school at Porter County. They encourage the student to fill out a survey. This survey asks multiple questions about the past month use of the substances. So one of the main very important data that I found is the mean age of first time use of alcohol was 10.36 years old in 2020. So I think this data is alarming for everybody because that means like a first time use of the alcohol is pretty young at Porter County. And if we're not looking at the mean age, but if we look at the 12th grade students, 1 in 3 12th grade students drink alcohol in the past 30 days. So that's another reason why we want to focus on the underage prevention, and we want to target the youth population. I do have a lot of data, so we're going to share later on, but now I'm going to turn the topic to Carley.
All right.
I just want to
Chris.
interject. I don't know if you mentioned this. I was in my head. Maybe I missed it. But if you don't know who Jay is, she is actually a epidemiologist. She's actually college trained in this in analyzing data. So she knows what she's doing when she collects and analyzes data. So I think it's important for people to know we're not just pulling these numbers off some random website.
No, she's working hard to compile it all together, day in and day out, and I can't imagine how many times or recall how many times I've gone into her office and like, how you doing today, Jay? And she's like, just staring at the numbers. That she's doing a lot of hard work, and it's great, important to point that out. Thank you, Chris. I think she's the only epidemiologist here in Porter County that I know of, at least. And
I was told recently we're the only similar organization in the entire state that has an actual real epidemiologist working for us. So I think that's critical.
Yeah. I mean, she has the training. There have been times when I've been like, hey, Jay, can you tell me this? And then she'll be like, yeah, that's not possible. That's not clean data. And I'm like, oh, thanks, Jay. Sorry.
Thank you. I love Porter County, and I love to engage with our stakeholders, coalition members. They are awesome.
Yeah. And they all, I think, respect you and appreciate you because, one of the great things about having Jay here on staff is if you are one of our partners, she can provide you the information that she's worked so hard to put together. And I mean, if you know anything about grant funding, you know that the numbers matter, right? We have to have the numbers to support getting grants. And so, Jay's got some information there. If you're one of our partners, reach out to her.
Yeah, welcome everybody. Email me, call me, ask any data information related to the substance use and the mental health. And I collect the data for looking for not the snapshot of the data size, but I look at the trending to see how that goes, and we are measuring how many a program we implement to the community and what's the effects, what's the impact to the community, and that's the measurement we are using. So it is really helpful because it helps us to target specific population, community, even the age groups. So it's very specific, and I use my data collection measure and the data analyze measure. So please, if you have any question, just contact us.
Yeah, and where can they reach you, Jay?
Yes.
How can they do that? What's the email and phone number?
So you can just go to our website, portercountysac.com. So you can just find our address and our phone number. My personal email is jchen at portersac.com.
Yes, perfect.
And that's J the letter, not J her name.
Yes, yeah.
The letter J, Chin.
Just Jay Chen. Yes, great. Thank you for sharing that. Good point out there, Chris. So with that, Jay really informs a lot of the things that we do. For those listening who haven't really interacted with us before, we have 3 coalitions. Well, we have 4 coalitions in total for the agency, but 3 of those are ones that were developed through the Partnerships for Success grant. So we have one in Chesterton, Portage, and Valparaiso, the 3 largest cities/towns in Porter County. And those coalitions decide on different programs that are relevant to their community, and then we implement those programs. And so some of the things that we have done in the past is we've had a focus on harm reduction. The main initiative that we did with that is the needle collection. So we were hosting a sharps collection site where people could bring in appropriate containers, appropriate sharps collection containers. They could bring in their sharps that they have used for medical purposes. And then they would bring them here, and we would hold them as a site, and then Stericycle would come and collect those from us once a month. And so that was a great program. Unfortunately, we are going to be having that come to an end here in October. So middle of October, we're ending that program. So if you are listening and you are somebody who utilized that program, or you were taking them to your local police stations, that program is ending here pretty soon. So just be aware of that. We were partnering with the police departments, and they were, along with their prescription drop boxes or drop boxes where you could turn in over-the-counter medications or prescription medications, they also were partnering those needle collection cabinets. And so that will be ending. So just as a reminder to you all in the community, if you were utilizing that, mid-October is the end of that program. We will be, and unfortunately, that's really all we can say about that. I know the hospital collects those containers, and so I would recommend reaching out to them if you are somebody that still needs a program like that, and see if they still have their program going as well. I mentioned our prescription drop box receptacles, and so we have funded through a previous Partnerships for Success grant and continue to advertise and fund additional take back days, but we have funded those boxes. So at any Porter County police station, excluding COUTS, you can drop off any prescription medications or over-the-counter medications as long as they are not sharps and they are not liquid. So be aware of that. Here pretty soon, October 29th, is the DEA's National Take Back Day. Have you two, Jay and Chris, either of you ever, I don't know, Chris, if you've been around for one, have you, for a Take Back Day yet?
No, I don't believe so. I just started in February. If there was one, it was right at the beginning of my tenure, and I wasn't very involved or aware of it yet. So.
Yeah. So this will be your first, so it'll be really interesting. You'll get to see kind of what the process looks like. And Jay, I don't know that you've ever been involved with one, have you?
I don't think so, but we do heard a lot of volunteers' feedback. It is pretty good because I remember one of the volunteers told us that people bring the expired medicine and they explain what's going on with their lives. So I think it's a good opportunity to share story with the law enforcement too, though.
Yeah, absolutely. So that's the benefit of the Take Back Days. There's two law enforcement officers monitoring that box during that day. And so if you have any questions or want to interface with a police officer, that would be a great opportunity. And sometimes we'll have volunteers at the sites as well who can provide resources and things like that. But if we don't have a volunteer at one of the sites, you certainly can talk with the local officers that are there, and they can give you some resources if you need it. So yeah, I would encourage you to make sure you take back your prescription medications and your over-the-counter medications. One thing we know is that having those medications, and especially with them being when they're not safely stored, they can create risk factors for either substance use or accidental poisoning. And so we proudly have the Take Back Day drop boxes to help reduce those things.
Yeah, if you're like me, I'm always paranoid about any kind of opioid. So after a dental procedure or some kind of medical procedure where I get prescribed pain medicine, I never finish the bottle. And then, you don't know what to do with it. You don't just throw it in your trash. Please don't throw it in your trash if you're out there listening. So it's important to dispose of it properly, and this is a great opportunity to do that. And they're not checking IDs or anything. If you're worried about that, just dump the medicine to keep it from, even if you think it's safe, you never know how it could end up in somebody else's hands. So unless you have like a medicine safe, like people have gun safes, get rid of it, because it's not safe no matter how unlikely you think it is to end up in someone's hands. It's important to just dispose of it properly.
Absolutely. And you mentioned that don't throw it in the trash. That's also important for environmental safety as well.
Oh, yeah. I think I read something where they were testing water like from different rivers and streams, and like I don't know how many antidepressants our fish are getting now, but it's just not healthy.
A lot, maybe.
Yeah. And they still don't seem happy. There's no pleasing those fish.
So take the opportunity to drop those off. We do also have those year round. So if you can't make it over on Saturday, October 29th from 10 to 2, then you can take it any time of the year as long as the police station is open. So I think most of them are kind of in their common areas. So typically you'll have access. We were also pretty recently, within the last, I think, year and a half, we were able to get one of the drop boxes over at Valparaiso University for their campus to use as well, which was a great partnership that we're really proud of. And we recently spoke with Natalie Muskin-Press, who is with Valparaiso University, and she coordinates a lot of their prevention surrounding substance use, and she also does a lot of treatment and interaction with her students. And she mentioned that the Dropbox is doing very well. So we're happy to have that partnership.
And if you'd like to hear more from Natalie Muskin-Press, she was on a recent episode that you can find on Matters of Substance wherever you get your, not wherever. I think we're still working on Apple, but everywhere else you can get podcasts, whether it's Spotify, iHeartRadio, etc. You can listen to past episodes, and she was on one very recently.
Yes, thank you. Yeah, she was a great guest. Interesting stuff, and I won't divulge it here so that you have a reason to listen. But some interesting responses to how COVID played a part in the college community and substance use that I was quite surprised to hear.
Yeah, so. It was very it's not what I would have predicted.
Yeah,
it's kind of interesting, but yeah, go listen.
Check it out. Okay, so we have Take Back Day coming up. We have we've shared about our drop boxes. We also, one other piece of Take Back Day that I think is important to mention is that we are open to hosting that in other community locations throughout the year. So the really wonderful thing is that while we do have 2 national days a year, we also can provide that as a service to the community. So in previous experiences, we have partnered with senior living communities, which I thought was a really smart partnership. So yeah, if you're with a YMCA, any kind of community coalition or a community center or a church, and you're like, I really want to address this issue in some way, but I don't know how, this is a perfect opportunity. We will, as long as you give us a space and you advertise for it, we will make sure we get the officers and the collection reciprocal there. So, just give us a call. You can reach us, me, Chris, or Jay, here at 219-280-5252. And we all have separate extensions, but you can figure out who you want to talk to once you get on the phone. There's a directory. So, yeah, so if you're interested in hosting one of those sites, please reach out to us. All right, so we've talked about Take Back Day. We have shared about the end of our Sharps Collection Initiative. So those are some of our more prominent opioid harm reduction prevention measures that we're doing. We also do a lot of things surrounding marijuana, which is right now, I think we're really kind of hitting that with some social media campaigns more than anything. So Jay's been instrumental in sharing on our social media. If you are on our Facebook or our LinkedIn, Jay's sharing things weekly, if not more, about varying topics. What are some of the more recent things that you've posted?
Last week, my routine is I'm checking monthly awareness day, try to find the prevention resources and messages that we can use for our community. So recently, I'm posting something related to opioid prevention, some research articles, and try to identify the national trends and also the state trends. But currently, this month is the Mental Health Awareness Month. So I'm posting some information about explain what the depression is, and if you observe some signs, symptoms, how could you help your family and the friends, and what resources you can utilize at a community level. Especially, we're providing mental health first aid training at the Porter County. So if you are interested for doing a free training to help yourself to save some lives, please contact us. It's a free training, and we offer to every community at Porter County.
Yes.
Yes. And it is very important to mention that next Monday, yes, it is our National Mental Health Awareness Day. So we are going to post more resources to our Facebook and the linking. Welcome to visit our Facebook, give us a like, and if you request more resources, we welcome you comment on the below of each post. We will get back to you as soon as possible.
Yes, thank you. And great mention there, mental health first aid. Chris and I are the trainers here, and we have trained
A lot of people,
a lot of people.
but we're willing to train more.
Yes, we are. In the last month, how many trainings have we done, do you think?
Oh,
Or
I've
last
lost-
3
yeah.
months, let's say.
I've lost count. We've done a bunch.
Yeah.
But moving forward, we're hoping to maybe do about one a month. Moving forward for the rest of the year and into next year. And we just need a certain number of people to have a training. But if you have a location, we can work on recruiting people. If you're just a single person or one or two people, reach out to us and we can try to connect you with one of our other trainings to get a group that's large enough to have a training.
Yeah, absolutely. Great. And we'll work with you as much as we can. But we do appreciate if you have a couple people.
Yes.
That's beneficial, but we can certainly get you trained up no matter what.
Yeah, if you have a location and have 10 or 15 people, that's perfect.
Yes.
But if you have 10 or 11, we can probably work on finding a few more people to fill out the class.
Yeah.
It works better. We don't want 50 in a class, but it works better to have at least 15.
Yeah, I think our top is 25.
Yeah,
So 15 to 25 is the golden range there.
it's the sweet spot.
Yes. So if you are kind of okay, well, that's great, but what's mental health first aid? So mental health first aid is something where we present. It's a long day. I'll be upfront about that. It's a whole day training, and then there's a couple hours of pre-work that you do at your own pace the week before. So. But what you're going to learn, what you're going to walk away with, is you're going to have skills to implement if you believe somebody is struggling with a mental health challenge, whether that is you're noticing that they maybe just don't seem quite themselves anymore and they've stopped coming out with you to get coffee, or they're not walking their dogs like they usually do. It could be as minimal as that, or it can be up to the point of a crisis level situation. And so we educate what all of those ranges look like. We learn practical skills called the Algae Action Plan, where the people who walk away are going to know how to identify if there's a mental health challenge going on, how to listen non-judgmentally, what kind of information they can give, whether that be like professional linkage to professional care, or just partnering alongside that person in something a little bit more simple if we're at that low level of challenge. So yeah, it's a practical action plan that you can use, and we have a lot of opportunity to make sure you know how to use those skill sets before you leave that training.
Yeah, and it's first aid, so you're not just like medical first aid. You're not the doctor. We're not psychiatrists. We're not doing anything other than recognizing the problem and helping them get to whatever resources are necessary. And in some cases, it may just be some self-help things they can do. Maybe encourage them to, talk to a professional. And then also in more serious crisis situations, you're trained on how to deal with that too. So just more and more, I think we're aware of how mental health affects our everyday lives. And I think every single person out there can benefit from this kind of training, just so you know how to handle situations. And again, we're not expecting you to treat the person. We're expecting you to sort of keep them stable while you help connect them to whatever resources might be appropriate.
Exactly. Yeah. So that's our mental health first aid program, which, by the way, our new ECHO coordinator is going to be working on coordinating. So our new ECHO coordinator is Samantha Aguilar, and she is a person who is a peer certified recovery coach. And so she's here to kind of be our recovery outreach and our ECHO coordinator. So Samantha will be charged with coordinating the MHAT program, the mental health first aid program. And you can reach her at that same number I mentioned earlier, but I'll throw it out there again in case you missed it, 219-280-5252. So you can reach out to Samantha. She will be coordinating, setting up those trainings. In addition, she is going to be actively trying to get some SBIRT trainings together. If you're not familiar with what SBIRT is, it's a brief intervention, a brief screening and intervention for people in like healthcare facilities. So for instance, if somebody goes to a local clinic and their staff is trained in SBIRT, then they would be able to determine if, just by asking certain questions, if that person is at risk of being dependent on the substances, if they currently are dependent on substances, and then it walks them through how to properly refer them to the right resources. So it can be a really beneficial training for healthcare professionals. It helps really determine what's going on and if the person is in need of care for something that has to deal with substance use. So if you're in the medical field and that's something you think you need to know more about, reach out to Samantha.
And I would like to point out, Samantha's wonderful. She's very energetic, but she is currently only in 2 days a week. So if you do reach out to her, leave her a message or something, just realize she's not in the office every day, but she will, I'm sure, get back to you. So just have a little patience.
Yes, thanks, Chris. Good point. Yeah, she's not here full time, so that's important. Okay, so we have talked about SBIRT. We know that's a service that we are currently offering, so please let us know if you're interested. We have talked about our Take Back Day coming up. We've talked about the Sharps collection. We've talked about mental health first aid. What else do we want to talk about? How about Region Recovery Riot?
Oh, we could talk about that.
Yeah.
That was awesome.
It was fun, right?
Yeah.
Okay, so why don't you guys share what that is?
Well, Region Recovery Riot was started by Kristen, right?
Mm-hmm.
There's a woman up in Gary. She's in charge of Gary harm reduction, and it was her sort of brainchild. She wanted to put on an event that just celebrates recovery for people in recovery, someplace safe to go where people understood their particular challenges, where they could be around other people in recovery, where they could have a safe, drug-free celebration, I guess, really. Yeah. And they also had a memorial, about just remembering people that have lost their lives to drug use, mm-hmm. substance use. But it was primarily more of a celebration of life. And our new employee, Samantha, was a part of that planning committee. Mm-hmm. And when they first started, I did not think they had enough time to put an event that size together, and they just did a beautiful job with it. Weather wasn't super cooperative, but we had a lot of indoor space too. It was at the Aquatorium in Gary, and I think I know it's going to be an annual event. They're going to work on maybe having it in different areas around the Northwest Indiana region mm-hmm. in future years, but it was just a really nice event.
Yeah, and I think it was it's one of the things I found really cool was that there was like a DJ. We have those typical vendor fairs, right? That like we all with it that are like working in the field know about. And we did have some resources there, which was nice, but it was like mostly like fun, food, and like just relaxation. It was pretty cool. Yeah,
they were like yoga instructors at different mm-hmm. points during the day, and mm-hmm. and yeah, like you said, there was a DJ. We were gonna have volleyball, but the weather didn't cooperate with that. But yeah, there was food. There was they secured a very generous donation and had some amazing catered food there.
Yeah, I think that's from the Aliveness Project, if I remember correctly. They donated the funds for the food.
Yeah, and so it turned out to be an amazing event.
Yeah, I was impressed.
Yeah, me too.
And we all got to paint, so that was fun.
Oh yeah. That was fun.
Yes, awesome.
Yeah, that was a great event, and we're excited that we were a part of that planning committee as well, and we're excited to continue partnering on that because I think it was an event that just is needed. It's needed in our community, and we were happy to support it.
Yeah.
So Chris, I think you attended most of the meetings there, so thank you.
Yeah, I don't know if I was one of the key players in the planning committee, but I was there.
Hey, we had volleyball under control, weather permitting.
Yes.
So yeah, check that out. It was a really cool event, and we're excited about the future. They also had, just as a side note, it was very family friendly. They had some kid activities as well. So it was really just to get people there that needed a fun place to celebrate. It was pretty cool. So.
And even if you're not in recovery, it can be a way you could have attended and supported the people in recovery. And again, it was just a safe space where people, I think it'd be a good opportunity for people that maybe don't have a lot of familiarity with the recovery community to see that people in recovery are just like everyone else in so many respects outside of their recovery. And so, we can learn how to just get along with them, respect where they're at, respect their journey.
Yeah. I love it. Respect the journey. That's so important. So that's one of the more recent things that we've done. We recently also did an environmental scan at the Popcorn Festival. We did a couple things at the Popcorn Festival, but Chris, if you wouldn't mind explaining what that environmental scan was, and then Jay, could you share a little bit about the parent survey that we recently completed as well? Because these were two major undertakings that we successfully did.
Yeah. No, this was my first year with the Popcorn Festival here with the Hub Coalition / Porter County Substance Abuse Council. One of these days we're going to stop using the / If you haven't followed along, we're in the process of rebranding. Hub Coalition will be our new name. But that's aside. Let's get to the environmental scans. We've been collecting this data for, I think, 10 years now.
Yes.
And what we're doing is we get volunteers to just walk around the downtown streets where the Popcorn Festival is happening and just record just things like signs they see advertising alcohol, tobacco use too, but alcohol is definitely the more prevalent thing. And they just they make notes. We don't approach anyone. We don't scold or shame anyone. We just make notes. Okay, we saw and we have different sides. We see a small sign, advertising alcohol. We see a large, medium sign, a large sign, and they just make notes where they saw it. And again, not to come back and scold anyone, but just to track the acceptance, the exposure and acceptance of alcohol in our community. And again, at Popcorn Fest, kids as well as adults are seeing that. So it's just to track the data and see what the trends are. And like I said, we've been collecting this data for 10 years now. So as Jay can tell you, as an epidemiologist, the more consistently you can gather the same kind of data, the more useful it is to identify the trends and stuff. So I think it's especially important that we've been doing this particular thing for 10 years now. And we get volunteers. This year we got some. Were they from Valpo? We had.
No, they're from. It's.
I shouldn't have brought it up. Neither of us can remember.
No, I know it. It's just like right on the tip of my tongue. It's Washington Township.
Oh yeah. Some young people with parental guidance, parental
supervision.
Yeah, supervision. We just didn't send a bunch of kids out to look at alcohol signs, but yeah. So it was kind of fun, I think, for the kids, and also some of us. I know Carley and I both did the scan too. But yeah, it's trying to get as much data as we can that we can just sort of track over time what the prevalence of alcohol and the acceptance of alcohol use in the county is. And go ahead, Al.
No, one thing I thought was really funny, and I just don't know why I find this. I mean, I shouldn't even say funny. It was just kind of on the nose for why we're here, right? So we're trying to determine what the youth are seeing and, all this stuff and gather how this impacts our community. And I'm standing there at the corner of some street and another, and I'm writing a little note of something I just saw. And as I'm sitting there writing, a family passes by me, and this woman points over to this, what I assume is a beer garden, I'm not quite sure, but a gigantic beer blow up I don't even know if you'd call it a sign. It's like an inflatable blow up beer can, and it's huge. And she turns to her child and says, "We're going to the big beer over there," and points to it. And I just, in my mind, I thought, this is why I'm here, right? Like, how normalized is this in this moment? Like, okay, where are we going? We're going to that big beer over there, So that's kind of the point of us doing it, right? To understand the norms in our community.
Yeah, no, that's a great example. And also, speaking of the norms and acceptance of alcohol in our community, that kind of brings us into a great segue into the other data that we collected that same day.
Yes.
We'll let Jay talk about the parent surveys.
Yeah.
Yeah, this year we're trying to collect our own survey. It's a community survey. So this survey is targeted with the parents at Porter County. I really appreciate it with our local stakeholders, such as like local YMCAs and also Porter County Library System. So doing like at least couple month data collection, I have been talking to people at the library, YMCAs, even though the Porter County Fair. So in total, like we collected at least 374 surveys, and the last data collection we did at a Popcorn Fest. Our volunteers, they are from Valpo University and the Valpo Police Department, and also we have awesome ladies. They are from the tobacco coalitions. So they are helping us to collect a survey, talk to parents about the underage drinking at the community level. At the same time, we are providing resources to the parents. The good thing is we are going out to the community, ask a parents' opinion. What do they think about the underage drinking? Do they think there is an underage drinking issue going on at their community? Or what's their behavior? Do they have like alcohol locked at their cabinet, or is it a refrigerator or basement or garage? So like all the indicators that we're using, just trying to figure out what can we do to help the community to understand it's very important to prevent underage drinking at our community level. So luckily we do have some good results, but we are analyzing the entire report right now. After we finish all the data like analyzing, we are going to post the result on our Facebook and even our organization website, so you can see the data result to what does the parents think about the underage drinking at a Porter County level. Especially, I really want to cheer up with all the parents. Thank you. You guys did a good job to help me to collect the survey. You guys are awesome.
Yes.
Yes.
Speaking of people doing a good job, I think, we've kind of mentioned some partnerships from the Porter County or from the Popcorn Fest, and we just need to like say the people, right?
Yes.
So I'm going to go with organizational leaders because I don't know all the people who actually like signed in to help out. But we had Carrie Higgins with the Tobacco Education Coalition who got us some volunteers for that day. We had Christy Shervanek from Recovery Connection who brought her daughter and a couple of her friends. We had Todd Willis from Porter Stark Services with him and his daughter, Kayla, who came out. We also partnered with the Christ Lutheran Church, who helped provide us incentives for parents to complete the surveys. Who else was that? We had Sam Burgett from the Valparaiso Police Department and Valparaiso University. She works for both agencies.
Yes.
And she had some volunteers come together, I think, through Valparaiso University.
Yes.
So we had great partnerships that day. It was if you don't know much about coalition work, our coalition thrives and survives off of our coalition members. We have 5 staff members here now, including Samantha. And while we do everything we cannot survive without our coalition. And so having them come to the table when we call and we say, hey, we have trick-or-treating bags going out, 300 next month. Can you stuff these for us? Or can you get a group of people together? And they say, yes, that's invaluable to us. We have to have our coalition members backing us.
Yes.
And this might be a great time to interject. we are open to more coalitions. Like Carly said early in this podcast, we have 3 city coalitions in Chesterton, Portage, and Valparaiso, and we're always happy to accept and invite people to join. We meet every month on the last week of the month. We meet in Portage on the last Tuesday of the month. We meet in Valparaiso on the last Wednesday of the month. And we meet in Chesterton on the last Thursday of the month. And you're welcome to come to the meetings. We're not gonna immediately like assign you tasks to do, but if you want to get involved or just want to kind of find out what we're doing, you're welcome to join those meetings. And you can reach out to get the times and double check the dates again. I'm sure you're not going to remember all of that if you're just listening in your car or something. But we invite anybody to participate if you have an interest in prevention and helping Porter County just be a better version of itself that it can be just by working on youth prevention measures and just a reduction overall in substance use, particularly substance misuse. We invite you to get involved, and it's a great community and it's a great networking opportunity too. So you get to meet and work with a lot of the movers and shakers in the community that also that share your interest in making Porter County a better place to live and raise families.
Yeah. And so if you are interested, reach out to Chris. Chris can be reached at crahe, R-A-C-R-A-H-E, at portercountysac.com.
And I've learned that you shouldn't say Ray first because everyone spells it wrong then. It's just C-R-A-H-E. So, don't try to spell Ray any way you've seen it as a first name or whatever. It's an odd German name, I think. But C-R-A-H-E at portercountysac.com. Yeah, and let me know if you have an interest, and I will hook you up with times and dates, or if you just want to volunteer for a particular program that we have going or an event. Reach out to me also, and I can get you connected to the right people and sign you up for it.
Yeah. And we don't have too much time left, so I want to mention a couple things that we have coming up. First, if you're listening to this podcast, I'm assuming you're going to be hearing it next Tuesday, which is just 2 days before this event. We are going to be having a Narcan training at our monthly county coalition. That's held at the Porter County Community Foundation. It's going to be October 13th, I believe I have here. Yeah. October 13th, 8 a.m., Porter County Community Foundation. It's our normal monthly meeting, but we will be enhancing that with a Narcan training. And so if you're unfamiliar with what Narcan is, it is a life-saving opioid reversal medication that you can administer. We do ask that you be trained to do this, but the training is very easy. Basically, it's a nasal spray that you administer, and it can save a life. So we recommend you coming and checking that out. If you don't think you can make it to that training, reach out to us. We are happy to coordinate and train, or to coordinate a training in the community. So let us know if you're interested in.
Yeah, and Narcan is can be used to treat opioid overdose, but it's also important to know it has no adverse effects to anyone that's not overdosing on opioids. So it's if you're not positive it's opioid addiction, it can't hurt in any way to go ahead and administer it, but it can save lives.
Yeah, so we have that coming up, and then next week, which is probably still the same week you're going to hear this, Chris and I will be presenting a mental health first aid to Positive Approach to Teen Health. They are an agency in Portage, Indiana, that has a lot of programs. I can't even list them all, but if you're interested in hearing about them, we do have a podcast with them, and that aired a little over a month ago, so you can check that out. But Positive Approach to Teen Health helps educate youth on positive behaviors, whether that be things regarding substance use disorder, sexual activity. I think they have like a finance course. I mean, they do a lot of different things. So check them out. But we will be providing mental health first aid to them. And so if you're interested, we can coordinate you getting in on that training. We do have just a few spots available, so let us know. Another thing that we have coming up that is A new initiative that we're doing, and you should be seeing this around town here pretty soon, is a father engagement father engagement campaign. And so you will see Chuck Harris, our board president, and he is also the Porter County recorder, on some billboards, I believe, with his family. And on that billboard, there'll be some information shared about the importance of father engagement. We know as preventionists that a huge protective factor is family engagement. And so the more family engagement, more family connectivity that youth have, the less likely they are to use substances as they, either in their youth or as they get older. And so it's really important. And there's some information that fatherhood.org shared that Jay was able to put together, but it just once again highlights the importance of having family engagement and specifically father engagement. I'll go ahead and share that children with engaged fathers are 43% more likely to earn A's in school and 33% less likely to repeat a grade level. And once again, this is per fatherhood.org, so you can see how there's a positive impact with that father engagement. I believe the billboards, if you want to see them, they'll be up. One's going to be on US 30 in Joliet, and this is in Valparaiso. And then another one on 130 South and 250 West, I believe, in like unincorporated Valparaiso. I think that is. So yeah, check out the pretty cool posts that we have coming up. And then Jay, are you doing any social media posts about this, or is it mostly just a billboard campaign?
I think most just billboard campaign, but like I used to post some like data resources to our Facebook, so people can take a look at it to see what's the trending percentage and is that decrease, increase, and they can find out like a causal relationship about certain like risky factors or protective factors relate to the substance use. So all this like research information you can find on our Facebook. So, and if you have a question and would like to learn more information about like specific topics and substances, so we welcome you to message us so we can look for information for you. And also we do have local resources. If you need help with that, we are happy to share the information with you.
All right. Well, perfect. So we have just about come to the end of our time here. So if there's not anything else that you two think that we kind of missed in our conversation that's important to highlight and bring up with our viewers or our listeners, sorry. We know that even one, I think it's, if I remember correctly, don't quote me because I might be wrong, but I'm pretty sure I'm remembering correctly, one adult who is a positive impact on a child's life can be pretty impactful with reducing substance use. And I think that kind of comes from like if you're looking at mentoring. So yeah, it's important to make sure that our youth have our parents and family members and other supporting adults who are engaging with them. So if you have hung in with us thus far, I just want to do one more reminder that we do have coalition meetings that last week of every month. And then those are for those city levels that Chris mentioned. And then we also have our county level coalition meeting every second Thursday of the month as well. So if you're interested in learning more and you're just like, I don't really know how to contact you, or I'm not sure I want to, I just want to kind of see what's going on, just drop in. We do have these posted. Typically with most of them, the locations are posted on our website at portercountysac.com under the calendar. So you can check that out too. And we thank you guys for listening.
Thank you.
Thank you. Have a great week.